Welcome back to Fox News at 4. Infirmary Cancer Care is taking a big step forward in the fight against cancer, and they're launching the Gulf Coast's first multidisciplinary clinic to provide same-day advanced care for patients. So this is a clinic that is open, and breast cancer patients have started to receive this care already. Very important, especially with October being Breast Cancer Awareness Month. So we have two guests in the studio to give you more information about this tool, McGugin and Carmel Verrier. Please say I said both of those names correctly.
McGugin, but yes.
Okay,
yes.
Thank you for the correction. I want to first talk about the importance of breast cancer screenings. And when you walked in, I asked you, is this like a busy time for you in clinics? And you said not necessarily. I interpret that as encouraging news.
I would agree. I think we just stress in this month, but really we stress it all year round, that screenings are so important for women.
Yes.
It's really important for your health, and I think we do a good job at that.
Awesome.
And we also take the opportunity to, this month, since this is Breast Cancer Month, to have a chance to tell people about prevention always, because we don't talk enough about it sometimes, and also to talk about their families, you know, and who may have been afflicted and what to do about it in terms of their own screening.
So talking about this clinic, how did it come about?
So as breast cancer treatments evolved, it's now a very tailored approach, and it really depends on the patient's diagnosis, and because of that, it's really important that the whole team is involved. So that's the surgeon, the medical oncologist, our radiation oncologist, and this clinic is such that you're able to meet the whole team at one visit, and we're able to come up with your plan at that time.
Okay.
So it's just really good for patient care and for patients.
Yeah, it sounds tailored. How does it work?
It's beautiful in that many times when you get the diagnosis, it's so mind-blowing already. It's kind of nice to show up one place where everything is there for you and you don't have to go in all different directions. So that's why we appreciate having each other to be able to do that in one stride.
And you touched on it briefly, but who's all involved in this team for the clinic?
So in addition to the physicians, we also have our genetic counselor, our nurse navigators, research staff, there's our physical therapists, dietitians. It's a whole group, and we're all there for the patient.
We hear a lot about convenience, and you know, sometimes it's not just convenience that determines whether a person goes out for that care. It could also be comfort, right? Knowing that you're not going to be alone, or when you're hearing that diagnosis, that someone is going to be able to walk you through the process. I would imagine this lends to that individual to help them get out.
Absolutely.
And I think some of the, at least with some of the patients, they've actually voiced to us that the fact that they love having to come and be able to have everybody there for them and not have to go back and forth. Because before then, you would have to see the surgeon. Then if the surgeon thinks you need oncology, then that takes another 2 weeks or a week and a half or whatever it may be. And then the radiation doctor, who might need to be involved as well earlier on to help plan the surgery, is also very important to get that in one place.
You know, it's easy for us to sit here and talk about it, but really we want to make sure that people are heeding the message. What's your last push, your final call to people watching right now?
Oh, I just think with this being Breast Cancer Awareness Month, like we've been talking about, being aware that screening is so important, and that not to be afraid to go get that mammogram if they feel something, to seek out medical attention. Breast cancer treatment has come such a long way, and that we have great teams within our own community to help you.
Get the mammogram, please. And if you feel something, don't be afraid of it. I have a patient of mine, and I have to give her credit. Obviously, I can't tell you her name, but it's touch those tatas. Because if you feel something, then you can do something about it early.
Okay, all right, great message, and thank you, ladies, for stopping by.